He burned his initials onto the liver with a high-powered laser. Then he sewed up the patient and acted like nothing had happened.
So this is actually a true story, and in this cartoon they put SB. His name was Simon Bramhall. He was a transplant surgeon in England.
But a week later, the new liver started to fail. The patient went back in, but this time she was treated by a different doctor, and he soon found the initials inside. The surgeon admitted it wasn't the first time he'd branded a patient.
So this actually happened twice in 2013, and then this discovery led to some legal actions against this surgeon. He was convicted of assault in 2017. He was fined 10,000 pounds, which is about $13,600, and was sentenced community service and lost his license. Ouch.
Using a toothpick might seem like a quick way to clean your teeth, but it can actually cause problems. Toothpicks are sharp, so they can poke or scratch your gums, which can lead to bleeding or soreness. They can also scratch the surface of your teeth if you're not careful.
So toothpicks, I would recommend staying away. It's much better to floss, internal brushes, or a water flosser. One of the issues that can happen with toothpicks is you can get infection. If this damages your gums, they can break off. They can actually push the food deeper. And if they break off, they can cause inflammation, and that is going to be a problem. You definitely would want to see a dentist if that happens.
And if a piece breaks off, it can get stuck, which can be really uncomfortable and might even cause an infection.
So once again, it's better to floss, use internal brushes, or use a water flosser, which is a steam of water to clean the teeth.
Ever feel sharp pain in your teeth from hot or cold drinks? That's teeth sensitivity, which usually happens when the enamel, the protective layer on your teeth, wears down. When enamel is thin or damaged, it exposes the dentin underneath, which has tiny pathways to the tooth's nerves.
So that's the most common way you can have teeth sensitivity. Another common way is gum recession, enamel erosion, tooth decay or cavities. Cracked or broken teeth can make them sensitive. Aggressive brushing can cause this. Also, frequent use of whitening products, be careful, can also wear down your enamel.
Acidic foods, sugary drinks, or brushing too hard can erode enamel.
Also, certain mouthwashes, age, and plaque buildup can cause these issues as well.
Some people use their teeth to pry the top off of a bottle. But should you actually do this? Well, as you bite down, the hard metal cap resists, putting excessive pressure on your teeth. And this might cause several of your teeth to crack under the strain.
You could also break them off and lose teeth as well.
Then the broken tooth could expose nerve endings, leading to intense pain and sensitivity.
This might require a dental emergency, so you don't want to do this.
The sharp fragments of the tooth could also cut into your gums, causing bleeding and increasing the risk of infection.
So, bottom line, teeth are not tools. Opening bottles with them may seem cool or convenient at the moment, but the risks far outweigh the rewards. Use a proper bottle opener to do this. Your smile and your wallet will thank you.
An African soldier would place an army ant on his wound, allowing it to bite down and clamp the edges together. Then, he would twist off the ant's body, leaving the head and mandibles in place as stitches.
So you'd have to find large enough army ants with strong mandibles to do this. This is an actual way some people would do this, armies would do this, in remote areas like jungles.
He would repeat this process until enough ants were used to secure the wound and wait for it to heal.
So, like I said, this would replace stitches or staples, and the head would naturally fall off in a couple days. This works because these ants have very powerful mandibles, which can tightly clamp and don't let go. And once again, it's mainly done in remote jungle or combat settings where medical help is unavailable.
Have you ever wondered why even a slight injury to your testicles causes you deadly pain? When any part of your body gets injured, the nerves present in that part, send signals to the brain.
So there are a lot of nerves in this. There's the ilioinguinal, the generofemoral, and pudendal nerves, which innervate this with thousands of nerve endings.
But only we boys know how terrible the pain is in the testicles. Most of our body is made up of bones and muscles which absorb any impact on your body. That's why we feel less pain in this parts.
So there's no bone or muscle protection in this area to help you out, unlike other parts of the body. So it's highly exposed and vulnerable to injury.
But when you injure your testicles, more than 4,000 extremely sensitive nerves send signals to your brain. When the brain receives so many pain signals, you feel extreme pain and you start fainting.
These are primitive survival responses. The body thinks that something has seriously happened. And basically, this has been around from an evolutionary standpoint. So it's believed this sensitivity is actually a protective mechanism to avoid damage to the reproductive organs, which are critical for passing on genes.
If you hold your pee for too long, your bladder will start stretching out.
Not a good idea.
Which means you would be able to hold more urine after each hold. But due to this bladder stretching when you go to urine, your bladder will make a habit of holding this urine and your bladder will never be completely emptied.
If you have to do this a couple times, it's fine every once in a while, but if you do this on a constant basis, this can eventually lead to damage to your whole urinary tract system, including the ureters, which are the tubes leading to the bladder, as well as the kidneys.
And due to this habit, your bladder would get infected over time with bacteria. So the best solution for this is never to hold the urine and let the flow.
So normally you want to pee maybe every 4 or 5 hours if necessary.
If you lose a piece of your fingertip and you're a small child,
Not a good idea to play with knives like this.
a scab will begin to form over the injury.
So if you had something like this, you definitely want to see a specialist like a hand surgeon for sure, as fast as possible.
Underneath, special cells begin to gather at the wound site, and in some rare instances, these cells replicate to rebuild the bone, skin, and nail, regenerating the lost fingertip.
Why this happens? Because younger children have active stem cells, which have a higher regenerative capacity. And some researchers think that tissue in the fingertip is similar to what others seen in regenerative animals like salamanders, so making this possible, but only in young children. And it doesn't always necessarily happen.
Cockroaches are known to crawl up people's ears while they're sleeping,
This is really gross and creepy.
and they do this because they're searching for food. You see, cockroaches are attracted to fermented foods like cheese and beer, and your earwax smells just as good to them. Now, despite urban legends, bugs can't crawl all the way into your brain.
That's true. You don't have to worry about that. But those are all types of bugs. This can include ants, spiders, and flies. They seek warmth, darkness, and moisture. This often happens with people who sleep on the floor or infested environments like tropical climates or poorly maintained housing.
She cried tears of blood when she woke up from surgery. You see, she was supposed to have work done on the left eye, but the doctor had operated on the wrong one. Realizing the mistake, he pulled out a needle and injected it into the correct eye. Then he grabbed a pair of scissors, and without gloves or proper tools, he started cutting. She screamed for him to stop, but he ignored her. And when it was over, she was left with permanent damage to both eyes.
This was actually based on a true story that happened in Chicago. Basically, after the case, the recovery room nurse noticed, why is she bleeding from the right eye when the procedure was consented for the left eye? And then the doctor did this right in the recovery room, and the patient in agony felt everything. But in any case, this was done in like 2017 in Chicago hospital, and I'm not sure exactly what happened to the doctor afterwards, but terrible situation.
After delivering the baby, he carved his initials in her skin with a scalpel. And even though the nurses saw, they didn't tell the patient.
So this is actually based on a true story. This happened in 1999. The patient's name was Liana Gedetz. She was 31 at the time, and she was actually a professional, a dentist. The doctor was Dr. Alan Zarkin. Because he claimed he did such a beautiful job, he initialed it. Really horrible.
When she got home, she felt excruciating pain. And when she looked in the mirror, she was horrified at what she saw. The cuts left permanent scars, meaning she needed extensive plastic surgery. She sued the doctor for almost $2 million. And even though he lost his medical license, he never went to prison for his crime.
This is really horrible situation, mistrust on the part of the doctor, total violation.